Thank you, Mr. Chairman. Thank you to the witnesses, especially value all of your testimonies, but Ms. Minor, Mr. Robinson, thank you so much for being here and sharing your very personal stories. It takes courage to do that in such a public forum, but it really does make a difference. I'm from Oregon, where, of course, this is affecting every community, not just urban, but also rural communities as well. 2015, 180 people died from just prescription opioids in Oregon. That doesn't include the non-prescription. I just had a community discussion on opioids in Clatsop County, Oregon, which is a pretty rural coastal community. My constituent, Carrie Strickland, who I'd met before, she created Jordan's Hope for Recovery. She lost her son, Jordan, started with a sports injury, following up on what my colleagues already mentioned, after a 7-year struggle with addiction and relapse. And her family's loss is just a reminder that we're talking about, real people and how this affects people in communities. But there were some very common themes there about the inability, and we had this roundtable, the inability when people are ready, the inability to get them into treatment. And there are just too many barriers. Like you said, we know what to do. We just don't have the resources in many cases. This crisis is tearing our families and communities apart, but it's not the first time we went through this back. It was about 30 years ago when the crack cocaine epidemic that was disproportionately affected marginalized minority communities, and unfortunately our country tended to respond with increased criminalization of abuse and addiction. And Dr. Wen, thank you for recognizing, as others have, that addiction is a disease. We should treat it as a disease. We know that our response then affected an entire generation of people and led to some pretty severe disadvantages and stalled educational progress and poor academic, employment, and life outcomes. So this is key, the conversation that we're having today. The president just declared that the opioid crisis is a public health emergency, but he didn't provide the financial resources that we need to fight the epidemic. So we don't just need a declaration, we need resources, and we know where they need to go: prevention, recovery, treatment. And by bolstering the Affordable Care Act, for example, Medicaid, fully funding the Every Student Succeeds Act, programs that provide for health services for our students who are in schools, this is all really important. I just visited a school-based health clinic in a high school in my district, and what a difference it makes for those students to have somewhere right there on campus where they can go, whether it be talk to a counselor, get a vaccination, get health care right there on campus. It really makes a difference. Dr. Cox and Dr. Wen, according to the original Adverse Childhood Experience ACE study by the CDC, individuals with 4 or more traumas were 12 times more likely to have attempted suicide, 7 times more likely to have alcoholism, and 10 times at greater risk for intravenous drug use. And we know that childhood traumas affect child brain development. Children living in households, as we heard from Ms. Minor, with addiction are living in environments of chronic toxic stress. So Warrenton-Hammond, which is a school district, again in Clatsop County in my district, is helping students by their incorporating trauma-informed practices into their school system. They've shifted from a punitive to a compassionate approach to school discipline. Suspensions have gone down, attendance have improved. So Dr. Cox and Dr. Wen, you know that teachers and our school staff are oftentimes the first responders to the opioid epidemic. So are there tools and resources that teachers need to build around our knowledge of childhood trauma in order to be good first responders? And I want time for another questions.
We are starting in Baltimore City. We've started trauma-informed care trainings, including for all of our frontline city workers, such as our teachers. We've done now trainings for over 2,000 of our staff so far. It's important to shift the mentality, not look at someone as the perpetrator of violence, but rather as the victim of deep trauma, and that will help us to break the cycle that we talked about. We also have to increase mental health services and substance use services in our schools too. We have to provide services exactly where they are. In addition to recovery high schools, also increase services and screening right in our schools.
Thank you. And Dr. Cox, I want you to respond to this. During Every Student Succeeds Act reauthorization, Congress authorized Title IV-A at $1.65 billion because members on both sides of the aisle understand the importance of these programs. Title IV-A is currently funded at $400 million. Now, we've worked very closely with AASA, the School Superintendents Association, of which you are a member, to try to increase that funding. Isn't it important that Congress uphold its promise to get that funding so we can get these programs into schools?
Absolutely. It is the position of AASA that we need the complete funding.
Thank you. It's not just the flexibility, it's the funding. And finally, I just want to close with a follow-up to the DARE program. I certainly hope it's been updated from its early 80s days because it was woefully ineffective. And I'm hoping that it's to an evidence-based program, because there are ways to figure out what works and what doesn't. And if it's evidence-based, that would be useful. I yield back. Thank you, Mr. Chairman.
Gentlelady's time's expired.